Hi, I'm Ken,
And I'm Yasmin.
and
And this
this
is
is Conversations
Conversations
with
with
Ken
Ken
and
and
Yasmine.
Yasmin. Hi, Dr. Cherryl L. Thomas is board certified in internal medicine. She attended SUNY Downstate Medical School and completed her residency training RPSM at Montefiore Medical Center in New York. The degrees of Masters of Business Administration (MBA) was received post-study at Rutgers University in New Jersey. She also obtained the proud designation of Clinical Assistant Professor of Medicine from University of Medicine and Dentistry of New Jersey, UMDNJ. Dr. Thomas is affiliated with some of the best hospitals in Central Jersey, including Robert Wood Johnson University Hospital, St. Peter's University Hospital, and the University Medical Center of Princeton at Plainsboro. She strives to provide the highest standard of compassionate quality care to her patients. With years of experience practicing medicine, she is renowned for her attention to detail and skill in prevention, diagnosis, and treatment of a wide variety of conditions and disorders. It is the goal of Dr. Thomas to provide a healthy lifestyle and empower patients where possible to positively impact their health by mindful choices and practices. In addition to her professional activities, she has a personal interest in world travel, photography, dance, and creative writing. I am so honored and pleased to have Dr. Cherryl Thomas with us.
Thank you for having me.
Thank you.
Dr. Cherryl Thomas, thank you for coming.
My
Um,
pleasure.
it's such an honor because I have the honor of knowing you personally. And with the vaccine rollout right now, I was just very curious how you felt about how it's been going.
I think that it's getting better. Just speaking from my interactions with my patients, there's quite a lot of anxiety about people who actually want it and haven't been able to get it. And I'm speaking primarily about seniors in the area. So I think that there has been a lot of challenges, but I'm hopeful that it's going to get better with increased distribution and supply.
What can be done to get to that point of improvement?
I think they're actually doing it now, the current administration, by um, buying more vaccines and also working to coordinate the distribution and on a federal level as opposed to state by state. So I think that things are improving. For instance, in the state of New Jersey, if you want the vaccine, you can actually register on nj.gov.
Mhm.
And from that data registry, they then can help you get your vaccine locally. What's been going on lately is because of the bad weather, a lot of the vaccine deliveries were stalled, and that's picking up now. So that's why I anticipate it'll be better. And then with the local pharmacies, CVS on board, I read recently that Walmart is also
Mhm.
gearing up to be a distribution site.
And what about the concern of the variants?
In terms of the vaccine rollout or just in
Yeah,
general?
the vaccine rollout.
Actually, I just saw this morning that there are, like, Moderna and Pfizer are both looking into whether or not they need to give booster vaccines to cover the variants. Thus far, their current vaccines they think will be enough, but it's ongoing research, and they are preparing to give booster shots for the variants. And
Mm.
speaking of the variants too, that also goes to why it's important that people get the vaccine, because variants are allowed to develop as the virus spreads from person to person. The virus can't spread from person to person. The virus doesn't mutate to create the variants. So that's just yet another reason for people to consider getting the vaccine earlier rather than later.
Ken, you're in Los Angeles. How is the process there in registering in California for the vaccine?
It all depends. I mean, mainly it's about, dealing with your primary healthcare provider. And then there are like websites that you can sign up to actually get the vaccine. Because I know people that have been able to get it so far. A lot of people that have worked in hospitals, essential workers that have already received it. But it's been extremely difficult because California, like we have our own variant here that they just discovered. I think it was like last week, that's specific just to California, which has been really difficult as far as dealing with the rollout, what's happening, because the information is pretty much, online for people that don't use, internet access as much as possible. So we've been having people from neighborhoods outside of where they live coming into underprivileged neighborhoods to get vaccinated. So the rollout's been a little bit, I'm not gonna say a little bit confusing, it's extremely confusing. Right now, I've had friends of mine that are caretakers that have had to sign up online and on the phone and being on the phone for 5-6 hours trying to get appointments for themselves and their patients. So I'm hoping that, within the next couple of weeks, it will get better, but it's been kind of extremely confusing because of the way that it's gone from the governor down to the local level. Getting the information out to the people that don't normally follow the news, so to speak. It's like you've got the telephone calls. I mean, one of my assemblymen constantly calls about the rollouts. So you can actually do a virtual town hall with him, or you can be on the phone as they basically, give you all the information. But it's about getting the information to the people that might not have internet access or aren't watching the news all the time. It's like, how do we help them get the vaccine?
I'm curious too, because there's a large church near where my office is. It's about 30 minutes away, and they're actually giving the vaccine there. Are any churches or religious institutions near you guys doing public outreach and actually giving the vaccines?
I've heard of them, but I have not seen them so much. I mean, like in comparison to when we were actually having the testing, just plenty of places where you can get tested. But as far as where the vaccines are, the information is just spread out. It's almost hidden to a point.
Do you think that's because of the lack of supply, that they haven't been as aggressive when it comes to getting the vaccine in terms of the information?
Now that we're in this different political world about a possible recall of our governor, things have been kind of stalled for that reason. Because like I said before, if you're online and you search for that information, you can find it. But I haven't gotten any like loose mailers. Like basically when we had in November, the amount of mail that we got as far as political candidates, everything that we want, tons of mail, just killing trees like left and right. Nothing about the vaccine. And I think if you're going to hit people, give them the information that they need to have, you've got to do mailers, you've got to do flyers. You have to do more than just television and random phone calls from numbers you don't recognize.
Doctor, do you agree that there should be a better means of communication in getting the word out in the process of registration?
Well, I would say every region is different because his experience isn't necessarily my experience. But you did make me think, because a lot of the patients that I see, they tend to know how to register. Their complaint is more that they're not getting an appointment.
Right.
So I think, again, it depends on where you are. And we have things in our office that we distribute to patients, letting them know how to register, what centers or pharmacies near, are places that they might try in order to get an appointment. Now, we can give them the information, but how successful they are with getting an appointment is another story. And that goes back again to availability of the vaccine.
I know of groups of people trying to help, especially the elderly who may not have that much experience or be as tech savvy in trying to continue to get online and try to seek an appointment. So I know groups of people who've been trying to help elderly neighbors or congregants try to get appointments for that reason, because they know the where to go with the research online, but it's actually getting the appointment and being persistent.
Yeah, it is true. And a lot of the people that I see, the seniors, it's their family. It's family or support people, or people in their support networks that actually reach out to make the appointments. Because like Ken said, with a lot of them, you have to go daily online to try to secure an appointment. And the other thing that I'm finding, again, in this area, is that those that can secure an appointment, it's not an immediate area. They have to go to South Jersey to get it. So then that again goes to needing transportation to get there.
Yes. I just read of a senior couple who needed transportation on a snow day. They had the appointment and they didn't want to miss it. So their own mayor drove them to their appointment. They called City Hall and and someone said, just hang out, just wait right there and we'll get you.
Mhm.
And it was the mayor.
Good for him, and good for
Good
them that
for
they
him.
were able to get there. But those are things that definitely need work. And the other thing that I read recently, that some communities have mobile units where they'll
Mhm.
actually go to the home of the people to get the
Oh.
vaccine. That's something
Oh,
that is not widespread, but I did read that some regions are doing that.
Mm. I
But
just read
again, it goes back to having the availability.
yes. Is there something about a vaccine for children? Is that coming soon or?
I can't say that it's coming soon. The current vaccines are recommended for age 17 and above. The studies really didn't include children. I
Right.
think the next phase are going to be adolescents, and then after that, children.
Mm.
Eventually, I think it will, but right now, the approved vaccines are for adult populations.
And when you're told you're not just vaccinating yourself, you're doing it for others, is that
Correct.
very important for us to consider as well?
Yeah, and I often say that to people that express the vaccine hesitancy.
Yeah.
First of all, I try to engage why they're hesitant. And then those that, once we address those points, those that are still hesitant for themselves, I always suggest that they consider their loved ones, their community. Because as you're alluding to, people can be asymptomatic carriers,
Mhm.
not have any symptoms, yet still spread it to a vulnerable population.
Mm.
So that's something that everybody should consider, not just for yourself, but for people that you may encounter that are at increased risk for complications from the disease.
A friend of mine just had her first dose. She had asked the people there who were giving the vaccine, "Oh, have you had the vaccine yourself?" And many people who were EMTs, or they said, no, not yet, and it's a personal choice. Are they They're obviously not mandated to have the vaccine if
No,
you're in
they're
the
not
hospital.
not currently, but I don't know what's going to come down the road. And the reason I'm saying that, for a lot of hospitals, you have to have the flu vaccine, or
Yes.
you can't work, or you have to have a note from the doctor. So I would not be surprised down the road that that is mandated for certain healthcare facilities, but currently it's not. And healthcare workers are like everybody else, in the sense that they have trepidation about the vaccine because of the newness, because of the speed with which it was developed, because of the past history of people being used in for scientific study without their knowledge or consent. So
Mhm.
there's a lot of people who have legitimate concerns, and I just urge people to do research, and then I try to talk about those concerns when I address them. Key
Yeah.
point is acknowledging the validity of the concerns.
I know we were going to discuss the hesitancy and the history of that as well.
I was given a talk somewhere else, and I did some research, and I found out, not we all know about, most of us know about the Tuskegee study. Is that
right.
correct?
Yes.
Hmm.
Okay. But even going further back in history, there was smallpox. When they started realizing people who milked cows didn't get smallpox, they would deliberately infect children. And these were children that were infected without their knowledge, without parental consent.
Mhm.
So there's a history of that. The other thing I learned from smallpox, just like what's going on in the communities now, the poor Black and Brown people were more adversely affected by smallpox. But when the vaccine was approved and was nationalized, who was getting it first? Wealthy people.
Yes.
So we're seeing some of the same patterns with this vaccine. In that case, the poor and the Black and Brown people didn't have a choice. Here they have a choice, and some are choosing not to. And again, you're seeing the wealthy amongst us who are less affected in terms of the severity,
Yeah.
getting the vaccine first. You mentioned California, Florida. There is an ongoing scandal, that some high income area codes in Florida are getting the vaccine in preference to some of the lower socioeconomic areas, and the
Mm.
governor is implicated in that preferential treatment.
Mm.
So it's like a repeat of history in terms of that.
How do we change that? How do we reach people and make this equitable and
Well, that's one of the things the current administration is vowed to do. As a matter of fact, I heard that 2 days ago, part of their task force, Dr. Fauci actually commented on that, is to make it more equitable. And then again, that goes with education and addressing people's fears and hesitancy. I think it's important not to ignore history. You have to acknowledge the history, but then talk about what's going on now. And I think one of the things that's important with Pfizer is to know that there was a young African-American female who was instrumental in the development of the Pfizer vaccine, of the Moderna vaccine. But within Pfizer, in terms of the clinical administration, there are people of color who are play key roles in that. And I think that's important for people to know. In addition to the studies for both vaccines were diverse in terms of the patient populations that were used. And also the numbers that were used were in the tens of thousands. So it wasn't a small group that were used in terms of the clinical studies to show efficacy and safety.
I think what you've just said, Dr. Thomas, would abate people's concerns, because I don't think what you've just said is as shared with people as it should be. I don't hear it all the time.
Yeah, and I think part of our job is to share our knowledge and what we've learned, and just encourage people to tell somebody else. And also in terms of people's fears, well, one of the fears that, and I had a lady recently, yesterday actually, who's over 65, smoker, African-American female, who would be considered high risk, but does not intend to get the vaccine. And I was able to talk to her about her fears. And at the end of our conversation, she was like, well, I might get the Johnson & Johnson, which is a win, because she's now considering one. And the reason she chose Johnson & Johnson is because it's one dose. So again, education and really listening, I think, is first and foremost important before any discussion, is to hear what their fears are or what their concerns are.
How would you address the fears of someone who had the virus and doesn't want to relive possible side effects that are parallel to what that person experienced during the virus?
What I would say to them is, first of all, acknowledge that their fear is legitimate, but also make them aware that because you've had the virus once does not mean you can't get it again. So you weigh the fear of getting the actual virus again against getting the vaccine. The vaccine side effects are mild. They're not long lasting. Whereas if you get the virus the second time, again, it's a toss of the dice, how severe you'll get and whether or not you'll be a long hauler. Have you guys heard the term long hauler?
Yes.
Yeah. So, and you don't know. So even with my own decision making regarding getting the vaccine, I did my own research, and then it boiled down to, what do I fear most, the vaccine or the virus? And for me, it was the virus. I think you have to weigh pros versus cons. And then when you do that and you still don't get a solution, then it becomes the fear. Which do you fear more and why? That's where the discussion can go to.
Do you foresee vaccines as being necessary for travel, for employment, for in the future, that this will be a major part of our lives?
I think so. I think so. And I also think you're going to have to show some type of proof that you've been vaccinated. And again, that's probably going to be a country by country decision. Some may just require that you're tested, for the antigen before you're allowed entry, but others may actually require that you have the actual vaccine. I wouldn't be surprised at all if that occurs.
How are we as a nation right now in comparison with other countries?
In terms of the
vaccine rollout?
I think the gold standard from my reading would be Israel, because they vaccinated quite a few of their population. I think the vast majority of their population has been vaccinated. I think the United States pales with most countries in terms of the rollout. The numbers are getting better in terms of the numbers vaccinated, but the rollout definitely could have been smoother. I think the current administration has only been there for like 6 weeks. So I think you have to really look at what happened prior, the information they had access to, et cetera, with how quickly they were able to get started once they came into office. Those things have to be considered.
Mm.
He has tall goals in terms of the numbers vaccinated in his first 100 days, and thus far it seems to be on track toward reaching that. I'm optimistic that things are going to get better. We just have to get organized, or better organized.
I'm glad you're optimistic, Doctor.
Yeah, I really am. I'm optimistic that things will get better. And even with the variants, as I said, the more people that get vaccinated, the less chance the virus has to mutate and create a variant.
The main question that I had is about the Johnson & Johnson vaccine, about like now that we have another one. That'll be extremely helpful. But when it comes to talking to people about the percentage of effectiveness that we get told about, how do you kind of deal with patients that may be worried about, the Johnson & Johnson, which I believe they said was 65 to 75% effective, explaining to your patients or the people what that actually means?
Yeah, and it's confusing in the sense that Moderna and Pfizer use different endpoints with their vaccination in terms of efficacy. They use different endpoints than Johnson & Johnson. So Johnson & Johnson's 66% efficacy against moderate to severe COVID, whereas Moderna and Pfizer looked at efficacy against symptomatic disease. So their endpoints were different. So that will skew the statistics. But what I would tell people is what they all do 100% is decrease deaths and decrease severe illness and hospitalization. And that's across the board for all three vaccines that are available in the United States currently. Does that help?
No, that does help. It's kind of like making sure that, because like you said before, like knowing those different endpoints, that doesn't get explained. It's, when you hear it, you basically go, oh, it's 65% effective. Well, why would I get this? And they're basically going through all of these changes because they hear the information and don't understand what that information actually means.
Yeah, and I think that that's something that journalists and people on television could spend a little bit more time explaining if they're going to give the statistics to say the second sentence. Because when you look at just the absolute numbers, you're right. Why would I want that?
Right.
But just to go the other step, and currently there are no head-to-head studies with the vaccines being judged against each other. It's all against placebo.
Okay.
And placebo, we know it's just like the sugar pill or water. So there are no head-to-head. So it's really difficult to say this one's better than the other one because there are no head-to-heads. And again, the endpoints for the different vaccines were different. But the key, and this is what I explain to patients, is 100% across the board. They all decrease severe illness, deaths, and hospitalization. Another question that frequently comes up is if you miss the timing of the second dose of either Moderna or Pfizer, can you still get it? And the answer is yes. The current window is up to 42 days for both.
Okay.
Oh, okay.
So that's something for people to know. And the other question that often comes up, if I get one Moderna, can I get the second Pfizer if that's available? In the United States, that's not advocated. The CDC does not recommend that. However, in Britain, they're doing it, United Kingdom. So then you have to see what studies will come down the line to show whether or not that's efficacious or whether or not it did harm in terms of the immunity that people might have gotten had they gotten two of the same. So that's something to be down the road. Britain is pretty much using what they have to get mass vaccinations because you do get some benefit from just one vaccine. You get maximal benefit once you get the second dose.
Okay.
So what United Kingdom are doing, again, they don't have studies to support it, but in theory, you understand why they're doing it, and we'll see what the studies down the road shows. But the United States, we're not doing that. The CDC doesn't recommend it.
Which way would you go with it? Would you do the mass vaccination with one dose and getting more people immediately and then seeing?
There's there's pros and cons to either. From my perspective, I'm going by the book, to me, it makes sense to get what you have to get the maximum efficacy. Again, United Kingdom is doing that, but they don't really know what the efficacy is going to be of giving two of different types of vaccines. I'd rather go with what I know and increase the production, get it out there, et cetera, which is what's going on. And I'm saying that with a caveat. Now, if we see that what the United Kingdom is doing works and people get the same immunity, had they gotten to Moderna or to Pfizer, then that will change here in the States.
Mhm.
I often use the analogy, it's like we're flying a plane while we're building it.
Mhm.
Because every month, every week, we learn something different, so things change. So just keep that caveat in mind. I'm going based on the data that I know to date, but that might change once we have more information from UK.
Doctor, friends of mine with daughters are concerned about fertility with the vaccine. Does it affect fertility? And I've had friends say, well, I'm going to make sure that my college age daughter does not get this vaccine because of that concern. Is there any research
I
with
have not heard anything about fertility, but I will say again, remember the vaccines are new.
that? Mhm.
I would be surprised. Again, I'm going to just talk about Pfizer and Moderna because I know more about them because they've been around longer. Um, those Pfizer and Moderna have in common that they're messenger RNA vaccines. Messenger RNA they're based on proteins. They're not based on live viruses or dead viruses. They're based on the spike protein of the coronavirus. And if you've seen pictures of the coronavirus, it looks like a dog toy with a
Mhm.
little ball with the spikes. So the spikes are the proteins that the vaccines are used against. That information is attached to messenger RNA. That is how it's introduced into your body. The reason I'm bringing this up, why I would be very surprised with fertility. Once that spike protein is introduced, your immune system recognizes it, creates antibodies, and the messenger RNA that delivered it is then destroyed. So what I'm saying is you're not left with the vehicle. All you're left with is the antibodies against the spike protein, which are there to help you should you get exposed to the coronavirus. So I can't see anything in the mechanism of
Mhm.
how the virus works that would impact fertility.
And pregnancy for pregnant women, your
In
patients?
theory, it is safe, but again, it's a new vaccine. Yeah. So it's a discussion I would have with the doctor, but from my reading, in theory, it should be safe for the same reasons that I was just sharing with you. Just like women get the flu vaccine and other vaccines. So live viruses are not recommended if you're pregnant. But again, this is not a live virus. It's not a dead virus. It's based on a protein.
And I keep thinking of what you just said earlier about, well, what would you rather have? Do you want the virus as opposed to the side effects? And that really is helpful if someone were to ask that question.
Yeah, it just boils it down to that salient question, which do you fear more? The beauty of these coronavirus vaccines, Moderna and Pfizer, is you're just dealing with a protein. Similar to the pneumococcal vaccine or the pneumonia vaccine, that's based on a protein. When you get
Okay.
vaccinated against pneumonia, you're not getting a live virus or a dead virus, it's based on the pneumonia protein. And the other thing that I like to bring out when people talk about the technology of how fast the vaccines were developed. The technology has actually been in existence for over 10 years. It was used to develop other viruses and also was used in research regarding treatments for cancer,
Okay.
malignancies. So the technology has existed. What's different is that it's being applied to this virus. The technology was used for other SARS viruses and also for the MERS virus.
Mhm.
I don't remember if it was for Ebola. I tend to think it was, but I'm not 100% sure on that.
Going along with that, when it comes to relaying this information towards people that, let's just say, aren't so scientifically based.
Well, I would say actually three things. Oh, the other thing which you said made me realize another thing that I've heard people say is that it can affect your genetic makeup.
Mhm.
And when you say messenger RNA, people think that. And the way I explain that, if you think of a fried egg where you have the yolk and the white,
Mhm.
your DNA makeup is in the yellow part, the yolk.
Mhm.
The cytoplasm is where the messenger RNA works. It never even gets to the yolk.
Mhm.
So it does not affect your genetic makeup.
Mm.
Now, in terms of how it was developed, as I would mention to them, like you said, the technology existed. The other thing, because of the pandemic being worldwide, there was a worldwide interest in this of having a treatment. So you had a lot of money being thrown at this. And the third thing, which is cynical, but is real, this virus crippled the world economy. There was tremendous motivation to find something to affect this virus. So you can look at it from the human, or you can look at it from the economic. A lot of money was thrown at this because of the damage the virus was doing, not only to human lives, but to the world's economy.
Ah, that explains.
Yes.
I want to ask Dr. Thomas. Okay, where should people get their information? Their primary doctor? Is there a source they should read that you recommend? Not, we don't mean social media. Where would you direct people to go? As Ken was saying, reading the sources.
The
What
easiest
sources?
and most accessible would be the CDC.
Okay.
And I can say, and I said it with a little hesitancy because under the last administration, a lot of the data from the CDC was watered down or tempered to meet the past administration's needs. I don't think that is still the case. So if you ask me the most widespread, easily accessible, it will be cdc.gov. I use a source called UpToDate. So if anyone goes to a library, there's a medical source called UpToDate. And it's just like the name implies, it's up-to-date medical information. It's unbiased. And then there's something else, which I don't think you can get from the library, but it's called Prescriber's Letter. And that's an unbiased resource too.
That's very helpful. What about World Health Organization?
Yeah, that's another one. But again, everything has been so tampered by politics lately.
That's why I asked you.
Yeah, that's why. Because even with the CDC, I was actually shocked at the last administration when I would go to the CDC and I would see things that I knew weren't true or that were slanted. That really just blew me away because my entire medical career, that was the one source you could trust. So even as I'm saying that, it's trust because of, past things. Some people may be a little hesitant, but widespread information, that's where you get it. And that's where a lot of people still refer. And I don't think things are as biased as they may have been in the last administration.
And I think
where do you guys go?
Well, I go to the CDC.org. And maybe I grew up in Atlanta, so I've gone to that building. Like, I remember when I was in high school, we actually toured it several times. So it was one of those things that politically watching what happened to that source of information was just, that terrified me more than anything else in the world, because at least that was a consistency that people could trust. And with that trust being obliterated, it was just difficult on a day-to-day basis of watching people searching for an answer for a question that somebody put in their head. It was the most difficult thing in the world to watch, because of knowing that if you don't have a standard in which you can go to, then everything else will take precedent.
Yeah, a non-political scientific standard. That's what I thought the CDC stood for until, again, the last administration. But I'm hoping that will come back and that the trust will be regained.
Did the AMA make a statement about that during the last administration?
Not to my knowledge. Not to my knowledge.
And it's hard to kind of step out against the administration if they're kind of responsible for certain amounts of funding.
Yeah, exactly.
You don't want to,
and your livelihood.
Yeah.
Your livelihood. That's a good question about AMA. I'm curious to know if I know like during the pandemic, they would make different statements about, but I don't know if they actually addressed the CDC and whether or not it was reliable anymore. I don't know. That's a good question.
Is your local pharmacy another source, your local pharmacist, to answer questions?
About the vaccines? Sure. Okay. I would tend to think so. I mean, that's a general broad, like everything is case by case and depending on who happens to be on staff. But I think generally, I think the local pharmacy is a good place to ask about vaccines, vaccine access, particularly like CVS.
Wouldn't that be wonderful if, how they give out the flu vaccine there, to be at a point where all your local pharmacies would be the source of your vaccine?
Well, actually, I went to a CVS this morning and they were giving it. And I was talking to one of the guys and he told me this was the first day they were starting it.
That's
Wow.
Yeah, so I
wonderful.
took notes. I could tell my patients, what CVS they should try to get to.
Oh, that's great.
Yeah, so CVS is definitely here in New Jersey. They're starting.
There was a ShopRite I heard of that was giving out the vaccine
Right.
as well, but
ShopRite too. Yep.
mm,
And I heard that Walmart, like I said, is also nationwide gearing up too. And I'm
this
hoping that eventually it'll get to the primary care doctor's offices,
I
because back to the
yes,
trust element, I've
Right.
had
yes.
a few patients ask me and I don't have access, but I
But
know
why? Why not? Why
because
can't, I would think you would be the first person I would go
I think
to
their
for.
their focus is like urgent care mass centers first, and probably once they have enough supply, then it'll trickle down to primary care doctors' offices. I think they want the mass centers where they can just vaccinate as many people in the shortest amount of time. But I think eventually, I'm hoping, especially when Johnson and Johnson coming online, because that doesn't require any special refrigeration,
Mhm.
that is a vaccine that we will have access to.
Do you agree with, I don't know if Ken has this in California, but in New Jersey, the tiers like category 1A, 1B, 1C with uh, first responders and I think teachers are B. And I'm surprised. I think every state has a different category tier of who should get the vaccine first. I don't know, Ken,
Um,
do you think it
does
should
it
be a national or is it by state?
I think this is CDC's recommendations. The categories, you have
Yeah,
the phase 1, 2, 3, and 4.
right.
And phase 1A, you had healthcare workers and first responders. 1B were people with comorbid conditions and older adults living in nursing homes or congregate settings.
I have to ask you, doctor, because I have a friend who is considered a 1C with one source she went to looking for a vaccine, and then she was moved to a 1B with another source that was giving out the vaccines, another group.
I
It,
think it depends again on how effectively you relay the information regarding what your risks are, and also how effective the person is who's taking the information, how knowledgeable they are in
yeah.
terms of the way you're assigned.
I, I
Um,
just I just wish it were more uniform.
yeah, and I think that's something that they're working on. That was
Okay.
part of the problem. The same with the way that the virus was able to become so prevalent in the United States was because there wasn't any federal coordinated response. And
Mhm.
that's
No.
why I think, again, with the vaccine, that's something that they're working on to get a federally ordained response.
Mm-hmm. Yeah.
And I think once that, again, we have to remember the current administration has been there 6 weeks.
Right.
Yeah, yeah,
So, and they're behind the eight ball because again, they were
right.
not given information prior.
Yes.
So we just have to always keep that in mind.
Oh, yes.
Yeah.
Yes, definitely. Yeah, it's amazing right now after, how many people have been vaccinated already.
Yeah,
That's
exactly.
tremendous.
It is.
That's
And then
tremendous.
the cases and the deaths are going down, hospitalizations are going down. We're really seeing it. One of the things that I've read recently, though, though things are going down, that they're concerned about a plateau because of the variants.
Mhm.
So that's one of the concerns. But on a positive note, the numbers are going down.
So if someone's been vaccinated, they should still wear a mask and they should still social distance.
It
And
is recommended. And the reason for that is because with some of the vaccines, though you may not get sick, you can still become an asymptomatic carrier. That's the whole
Mhm.
reason for that. So again, it
Yeah.
is more protecting those around you as opposed to yourself at that point. My understanding, it may be a year or so before they are going to recommend not wearing the mask.
oh,
Mm.
I'm just hearing people who've been vaccinated just feel like, oh, now I can do all the things I couldn't do before. And I'm thinking, well, maybe people should slow down a little bit.
Yeah, and that's actually one of the reasons why they're concerned about the numbers, because I think the numbers currently are about 70,000 cases,
Mhm.
United States. And that's why they're concerned that the number is going to plateau there because people relinquishing some of the mask wearing and the social distancing. And it's understandable. We are all fatigued. I'm
Yeah.
fatigued. if I never see another mask,
Aw,
I'll be okay. But I know what I have to do.
yeah.
But it's understandable. It definitely is understandable. But yeah, we have to still be careful or things will not continue to go down. That's the fear.
And restaurants and theaters. I know you're a theater patron, and Ken and I
Yeah.
discuss the
And
theater a lot.
restaurant.
And
Yeah.
restaurants, I know that as well. What do you think? Do you think there's going to be a time in the near future theaters will come back, live theater with
Well,
the
yeah,
vaccine rollout?
I heard recently that they're thinking about reopening Broadway, I think in May, but with very limited numbers
Oh,
in the audience. Um, Whether or not this premature, we'll see. But they are thinking about it. And some of the restaurants have been given permission to open up too, but the numbers that they're allowing is still reduced. I don't remember what the numbers are, but it is pretty reduced because I know the restaurant people were complaining that they thought it was still too low.
Doctor, I would love to hear your perspective on schools and school reopenings and in-person contact.
Mhm.
How do you feel about that?
I think,
What?
like with anything else, it depends on where you are in the nation and how prevalent the virus is in that particular area in terms of school openings. I think places where cases are still rising and they have a lot of uh, infected people, those are places that probably should not be looking to have in-person teaching quickly. I think places with lower rates um, should consider it. But if you do open, questions that I would ask is what kind of ventilation system are there? What kind of things are in place to maintain social distancing? Processes do they have in place? Do they have a team should someone become positive and how to handle it? Those are the type of questions that I would ask as a teacher and as a parent.
Okay.
Ventilation is really important, particularly in a closed setting with poor ventilation, because that's a way for the virus to spread.
I know a restaurant owner who can't, he's only doing takeout because he could not afford the new ventilation for his restaurant.
Yeah, it's
So,
tough. I was actually looking at a statistic and they were like with minority businesses, and it said 41% of Black-owned businesses have closed permanently due to the
Mhm.
pandemic. And even where I'm living now, there was a place that's been open for the last 20 years and they're closed now. And I remember
so
talking to
sad.
one of the ladies there and she was telling me how hard she was hit. 2 weeks later, she's closed.
So sad.
Yeah,
Just
it is.
heartbreaking.
It really is.
It is just This has been a tragedy. This has just been a tragedy on so many levels, and just all the people who've died
And
and
the things that have been effective. And then when
all
you hear
the
about people in the restaurants partying,
businesses. Oh,
Yeah.
yeah, it's and who's going to be affected by that? Their
Right.
grandmother or the healthcare worker that they're going to be exposing in the emergency room. It really does. Back to your points, it still needs to be taken very seriously,
Mhm.
despite our fatigue.
Right.
do you feel there's a lack of empathy or just a lack of seriousness across the board that we need to be
I
take
think
more
you,
sober about this?
I think so, but I also believe that was partly due, and is still partly due by the mixed messages in the media from our quote leaders, the government.
Yes.
There's mixed messages, so a lot of people are confused.
Okay.
Some are ignorant, but others really think that they're doing correctly based on the people that they support or listen to. And I think if there was a consistent message, then things might not be ignored. Even when you look back again at the past administration, I have never in my career seen a virus politicized.
Mhm.
Mm.
The
Mm-hmm.
virus doesn't care whether you're Republican, Democrat, Independent. The virus does not care whether you're Christian, Muslim, Jewish, Hindu. It's a
Yeah.
virus.
Mhm.
Yeah.
And that's the thing that I found most fascinating and most disheartening, just how politicized this was. Even wearing a mask
Yeah.
became political. It was very silly to me. It's a virus, but people behaved as if it was a political
Yeah.
Yeah.
entity. And it's just silly and sad.
And that wasted so much time.
Exactly.
Precious time.
Precious time. I remember talking to someone who asked the question, did I think that the United States could have handled this better? And I said, absolutely. You know, and I went down a litany of how I think the United States could have handled this better. And then I was told, you're being political. And I said, no, I'm not being political. I would have said that if this virus is handled this way by Barack Obama, George Bush, Bill Clinton, Jimmy Carter, Richard Nixon, I would have had the same opinion. It was handled wrong, and it did not have to be as bad as it is in terms of the penetrance in this country.
The actual idea of politicizing wearing masks, it's like, why?
Yeah.
You know, at the same, you know, it's like, it's not like saying, you know, I don't care if you wear a mask. It's like they're stupid, they're wrong, they're not going to help. That's completely different than saying, you know, well, whatever. And that's the thing, to weaponize it.
Yeah, to
in such a way.
weaponize it. And
And
then
the
when you think
legacy of it.
the legacy of it, and then when you think about it, it becomes convenient to focus people on wearing a mask versus not wearing a mask, as opposed to having them focus on the fact that there's a deadly virus in the United States.
Right.
It's like a diversion. It's horrible.
My heart breaks when I think of there was a piece in the Times of the objects that were left by people when they walked into an emergency room, thinking that, you know, in the little plastic bags, thinking I'm going to go
Yeah.
home that day. And they what should we do with those objects? Should it be a museum? People's cell phones, people's wallets, pictures of their families. I think of the generation of orphans now, people I know in their
Yeah.
20s, 30s, 40s, 50s who don't have parents anymore, children who have no grandparents anymore.
And can you imagine being sick in the hospital and dying with no loved
Alone.
ones with
Yeah.
you?
That's the
With
thing,
a
you know.
stranger holding your hand?
I hear people say, well, it's God's will, you know, we're all going to die one day. And I said to someone, you're going to die alone. You
Yeah.
are going to be alone. And
Yeah.
that's,
Yeah, people weren't having these same type of arguments when it came to seatbelts.
Exactly. Or
You know,
taking your sneakers off at the airport. Nobody argued about that. And it goes again. And do you like taking your sneakers off at the airport? I don't.
you know,
But I
do.
did it because it was necessary. Exactly. Yes.
Right.
We know you don't. But we did it because it was necessary. There weren't any mass protests. But it
Yeah.
goes again with the message that was given universally.
How will you, as a physician, as a professor of medicine, how will you in the future, how will you teach this? You know, when, you know, I don't want to say when this is all over. I don't know if, you know, if we'll ever be normal again, but how would one remember this, communicate this? How do you teach this in the future? What do you say? What was this?
Yeah, what was this? That's the question.
What was it?
I think my focus would be not to politicize a virus or not to politicize an infection or an illness. To try to stick to the science and the facts. How would I teach this? How can you explain this, what's going on in this country?
Mhm.
That's not an easy question, because it boggles my mind every day when I think of the different things in this country. It's just, you almost can't believe what's happening, yet it is real. Because it doesn't make sense. It's not logical, and it's counter to survival. Some of the people who are fighting this are the very same people who are going to be the most impacted by it. So how would I explain this? I would say a lot of people drank the Kool-Aid that shouldn't have. And I don't know if you have that reference.
Yeah.
Yes.
I guess the question that I had more is when it comes to basically helping communities of color understand the necessity of getting vaccinated at this point in time. Having conversations on a daily basis of young African-American men in their 20s talking about how they're not going to get the virus and giving me some BS reason why. About how to reach out effectively. And again, like you said, people will only absorb the information that if it's told to them the specific way, making that outreach more accessible, if that makes sense.
Yeah, and I think, for instance, a 20-year-old, one of the things that would be key with reaching that person is knowing what or who he values, because for that age group, it's not so much about them, but them exposing someone that they love
Mm-hmm.
who might have a serious outcome from it. So I would probably approach that unless it was like a fear of the virus, in which case then I would discuss the fear of the virus. As far as the disparities of the infection in Black and brown areas, that is a lot of reasons for that.
Mm-hmm.
One of them, a lot of them are frontline workers. A
Mm-hmm.
lot of them, live in multi-family dwellings. So their social distancing is nonsense. They can't.
Mm-hmm.
In New York City, a lot of them use elevators, the subways, the buses. So that is partly why you have a lot of the numbers there. And then the severity is because of the comorbidities that already exist in those neighborhoods.
That's the information I needed to get
Yeah,
out. Because the thing about, like, again, you have a reporter saying like it's affecting the African American community at this percentage. There's no like, well, this is why it's affecting the African American community at this percentage. It's
yeah,
just, again, it's like the information that we're getting is broken down through these easily digestible lines.
yeah. And
But
the other thing that I emphasize is not genetic why it's affecting the populations. It really does have to do with the things that I had mentioned. And I think that's important too, to recognize that it's not a genetic predisposition. It really has to do with where you live, where you work, et cetera, and what kind of health conditions that you've had that might make you more susceptible to the severity of the illness should you contract it, which goes again to why younger people want to get it, not for themselves, but for their mom, their grandmother, their dad, their uncle.
mm-hmm.
I remember at the beginning of the pandemic and just, just going into an unknown territory with information, I remember being told by the media, it's just mostly men who have to worry about it. Do you remember that? It was mostly men, or it was people of a certain age, or it was just people with if you have a pre-existing condition. And there was sort of this evolution when we started to see all kinds of people uh, getting the virus and dying from the virus. But do you
Yeah.
remember at the beginning, they said, oh, it affects men more than women. That was at the very, very beginning. I remember hearing that. They said, oh, don't worry about it. It's men. Men get it.
The media was spending a lot of time wanting to be first rather than wanting to be correct.
Yeah.
At the earlier part of this, they wanted to let me have the breaking story and say that this is what's happening rather than let me make sure that this information is correct.
And doctor, here we are almost a year later.
Yeah. And then the other thing to bring out, and a year later, and more people have died from this than World War I, World War II, and Vietnam combined in 1 year.
In this country,
and that's something else to bring out. And then when young people, just back to the other statement, say, well, only 98% people get really sick, then when you look at the absolute numbers, for instance, in the United States, you're talking 28.1 million. So 2% of 28.1 million is close to 300,000. So when you break it down, when you say 98%, but 98% of what population? And when you look at that and you look at absolute numbers, 300,000, or if you look at United States numbers now, you're over 500,000.
Yeah.
So that's 500,000 have died. So if they use the statistic, 98% people get better, yeah. But when you're talking about, but you're still talking over 500,000 people who have died. I think that might resonate more than the use percentages.
Yeah, absolutely.
Yeah, because hard numbers is something that people can see. Math is it's not an American trait, so to speak.
Yeah. And even the stat about the more people died in a year than died in 3 wars that took place over numerous years.
Are you curious about future data on how this lifestyle we've been living, this very dormant, sedentary lifestyle, will affect us in the future? That we spent a year. I mean, I know that everyone's trying to do things at home, like 40, for me, 45 minutes of exercise a day is not the same as what it was with walking. And how will, what that data will look like in the future, that we all were very physically, mostly still. And I think, people ate differently, they moved differently.
And the emotional impact.
Emotional impact,
yeah. Because I often say there's social distance and then there's emotional distance. So down the road, it'd be really interesting to see how it affects people, because I can't imagine that there won't be some long-term effects for some people.
Physically
I can tell you, yeah, physically, I can tell you in my practice, I see a lot more depression and anxiety. Yeah, it's hard on a number of different levels.
What's your advice to people to maintain their health, physical and emotional health? What would you say to your patients, to anyone listening? What can we do?
Well, I tell people, everybody, when the weather permits, to try to get outside, take a walk. I mean, if there's an exercise that you like to do outside, then do it. And I also emphasize the point, social distance does not mean emotional distance. So to reach out to loved ones, either via Zoom, via the telephone, have somebody drive by. If it's such that you can't get close to them, it's still helpful to see them and wave.
Mm.
Yeah, but to definitely connect. And then also, if there's somebody that you know that may not be able to, you reach out to them.
Mm.
That's that expression, I am because you are. So we take care of each other.
Thank you, Dr. Cherryl Thomas.
Thank you, Dr. Cherryl.
It's
This
an
was
honor
great.
having you.
Yeah, my pleasure.
Until next time. Who starts? Hi. How do we do that? Hi.
I do. Hi, I'm Ken.
And I'm Yasmine, and this is Conversations with Ken and Yasmine. Okay.